This is Dr. Jeff Hsu. We're joined by Dr. Billy Caceres and Dr. Carl Streed. Dr. Billy Caceres is an assistant professor at the School of Nursing and the Program for the Study of LGBT Health at Columbia University. Dr. Carl Streed is an assistant professor at the Boston University School of Medicine and research lead for the Center for Transgender Medicine and Surgery at Boston Medical Center. What are some of the known and documented cardiovascular health disparities in this population of LGBTQ adults?
First, I think it's important to state that although this population is usually combined for research purposes as one group, that the LGBTQ population includes many different people, and the groups within the population have very different needs. So for instance, we know that tobacco use tends to be high across all groups of LGBTQ adults, and it tends to be about 2 times higher than their heterosexual and non-transgender peers or cisgender peers. We also have evidence that alcohol use is higher among lesbian, gay, and bisexual adults, but specifically among lesbian and bisexual women. There's a rich body of research that really indicates that alcohol use is a significant health concern in that group. And similarly, there is evidence that shows that obesity and hyperglycemia are both concerns among lesbian and bisexual women. To date, there's been very little clinical data that's been used in research to examine cardiovascular outcomes among LGBTQ adults. But what we do see is that transgender individuals, specifically transgender women, appear to have higher rates of heart attack and stroke. And the prevalence of heart attack and stroke is actually higher among transgender women that are currently taking what we call gender-affirming hormones, so feminizing hormones like estrogen or progesterone, and that risk actually increases among transgender women that are on gender-affirming hormones and also currently smoke tobacco. I think the other risk factor, and it's really an emerging risk factor for cardiovascular disease in this group, is sleep health. The research seems to indicate that lesbian and bisexual women are more likely to report having sleep problems like short sleep duration and other sleep concerns. And a smaller body of research has found that transgender individuals also report high rates of sleep problems. We're really just, I think, scratching the surface of sort of the differences that exist between the groups and in the population really as a whole, and trying to identify what factors contribute, trying to identify what those causes might be.
And I think it's important to recognize that the field of LGBTQ cardiovascular health research is really expanding as we have improved research methods. Only recently do we now have information around sexual orientation and gender identity to begin to look more closely at these risk factors, these risk behaviors, and these cardiovascular outcomes among LGBTQ individuals as well.